Hello. Our treatment plan was constraint-induced language therapy, CILT. My name is Adriana Carmona.
I'm Claudia Palma.
And I'm Julia Stashik. So the authors of this specific treatment that was developed in 2001, the main one being Friedemann Pulvermuller. His main interest is in the neurobiological basis of language, and he currently teaches and is the chair for neuroscience of language at Freie University in Berlin, Germany. Some other authors include Bettina Nenninger, Thomas Albert, Bettina Moore, Bridget Rockstro, Peter Kobel, and Edward Taub. So the purpose of this treatment, it was derived from a treatment known as the constraint-induced movement therapy. And this was used for chronic stroke patients to remediate motor behavior. And the authors of this treatment thought that there would be a possibility for language impairment to be remedied given appropriate modification of the CI therapy techniques. Aphasia patients use communication techniques that are easier to access for them, such as nonverbal gestures and drawings, and words that are easy to produce utterances. These nonverbal techniques need to be suppressed during CI therapy to focus on verbal communication. So in short, they're forced to use words that they normally would neglect. There's three main principles of CILT. The first being constraint, to use verbal communication instead of nonverbal communication. The second principle being massed practice. So there's a high intensity of treatment. So there's 10-day interventions, 3 hours per day. And the last one being shaping, which is the difficulty of tasks get enhanced over time based on the patient's performance.
So the type of aphasia appropriate, CILT is mainly used for stroke-induced chronic aphasia. These include non-fluent aphasias and fluent aphasias. The non-fluent would be Broca's aphasia, and fluent would be Warnicki's and conduction aphasia. And the severity for CILT, it targets moderate to severe aphasia. The materials used in CILT, subtest of auditory comprehension, word retrieval, repetition, and lexical decision. 2 or more participants are needed, not including the clinician, therefore it would be a group therapy. Picture cards, as you will see in our demonstration in just a minute, and barriers. They must be solid material and high enough so participants are not able to see one another's picture cards. In our demonstration later, our barriers will be our screens since it will be via teletherapy.
So the recommended treatment schedule, the standard dosage for constraint-induced language therapy is 30 hours across a span of 10 days. Typically, it occurs for 3 hours per day, 5 days per week for 2 weeks. While it's possible to provide a more distributed dosage, evidence suggests that a more intense dosage has better results. The outcome measures used are the Western Aphasia Battery, which is used for pre and post intervention testing, as well as for follow-up testing. Specifically, they examined the difference between pre and post intervention aphasia quotient scores. The protocol. Patients are put in small groups of 2 to 3 patients, as well as the therapist, where they then play a therapeutic game. So the game is played with sets of 32 cards containing one of 16 pictures on one side, 2 copies of each card in the set. Each person is separated by barriers to prevent them from seeing each other's hands and cards. The task is to pick one card out of the set without showing it to co-players. Explicitly address another co-player and request a card with the depicted object. When addressed by a co-player, a participant's task is to determine whether he has the card with the requested object on it, and if they do, to give it to the co-player who asked for it. If the participant does not have the requested card, which is frequently the case because only 2 copies of each card are in the pack, he or she must deny the request explicitly. All communication is to be performed by use of spoken words or sentences, and pointing or gesturing is not permitted.
Notes and comments. So, was this treatment easy to learn? For our group, it was easy to learn. By teaching the 3 main principles of CILT, clinicians would be in good standing regarding treatment plan. Is it easy to administer? Yes. CILT is based off of a set of principles as stated above. Number 1, using verbal communication instead of gestures. Number 2, increasing intensity of treatment. And number 3, shaping, which includes increasing difficulty of task according to performance. Can we add homework and or train a caregiver to practice at home? Due to high intensity of treatment, adding more quote unquote homework would most likely not be beneficial to the patient. And this goes into our next point, how often this therapy should be done. The treatment is to be performed for 3 hours per day in 10-day intervals. Therefore, if we added more homework on top of 3 hours per day for 10 days, it would most likely lead to client fatigue. Do you think it will generalize well to the aspects of communication, word level, or discourse, and to the settings and context? Yes, it can be generalized throughout all settings and contexts due to the nature of the treatment. Something that we didn't like about the treatment, we thought that the procedures were vague at first. There are also not many examples of it being done to it being a fairly new treatment plan. It was actually created in the 2000s, so as far as research goes, it is fairly new. What do we like about the treatment? We like that this treatment is used with high intensity in order to really get the patient to grasp onto using verbal communication, and that the difficulty increases over time based on patient's performance rather than having set times to increase it. And how would we change the treatment? We wouldn't change the treatment itself, but increase the research behind the treatment to gain a better understanding. And here are our references.
Okay, Adriana and Claudia. So for today's session, we're going to play a picture card game. So we're going to have you both take turns asking each other for a matching picture card, very similar to Go Fish. So when you're asking your partner, if you don't have it, make sure to let your partner know that you don't through saying it verbally rather than through a gesture, okay? So let's start with Claudia. She could go first.
Do you have dog?
Okay, Adriana, I like that you acknowledge that you didn't have it, but let's remember we want to use our spoken words to let our partner know, okay?
Yes. No, I do not have the card dog. Claudia, do you have bat?
No. Do you have bug?
Yes. Here you go.
Thank you. Do you have dip?
All right, Adriana, let's remember we're going to say it verbally, okay, not through our facial expressions.
Yes, I have dip. Here you go.
Okay, so we're done with our session. Those are some really good verbal responses.
Thank you. Bye.